Good morning. Thank you, Johannes. I would like to thank the ITI Scientific Program Committee for the annual meeting to trust me to talk to you today about the implant number in the Edentulous jaw, practical considerations for the fixed rehabilitation. So my agenda today will be to discuss practical but evidence-based considerations to assist us clinicians in the decision-making process to choose the number and distribution of implants for fixed complete arch restoration. So you have this patient next week, fully edentulous patients. What do you think? How would you proceed with your treatment planning? What are your surgical decisions? How many implants do you use? Do you add or you remove bone? Do you place them parallel or do you tilt the implants? Do you place parallel size implants or do you place tapered implants? Or what kind of implant do you do? Do you do immediate or you do conventional loading? How do you distribute and what is the position of your implants when you restore these patients? So we looked at the ITI consensus concept, the number of implants placed for a complete arch fixed prosthesis, a systematic review. It was a great pleasure to work with this amazing group, Tara, Professor Emmett from IU, Tom Taylor, Dean Morton, Will Martin, Wei Shaolin, all this amazing group. And when we looked at the data, the question was, in patients with an implant-supported fixed complete prosthesis, do implant and prosthetic survival outcomes differ between 5 or more compared with when fewer than 5 implants were used? So we researched the literature, including patients with the complete arch fixed prosthesis, at least 10 patients with minimum follow-up of 1 year that clearly stated the exact number of implants for each arch and described the survival rates. We excluded zygomatic implants and we only looked at prospective RCTs, cohort, and retrospective. So this is our PRISMA flowchart. We can see at the end that we ended up with 93 studies included, 28 for the maxilla, 46 for the mandible, 19 for both arches.